Good afternoon, everyone. I'm going to start screen sharing so that we can begin our meeting. Commissioner Scott, when you're ready.
Now hereby call this meeting to order. Secretary, would you please call the roll?
Yes, thank you, Commissioner Scott. Commissioner Randy Scott, Chair.
Present.
Commissioner President Follansby. Might be on mute.
Yeah, present.
And Commissioner Zavansky.
Here, present.
All right, with that,
we have quorum.
thank you. In that we do have a quorum, we'll proceed to item number 3.
All right, I'm going to give the screen over for our first presentation.
I do have an introductory comment about this.
Can you see it now?
Yes. As this meeting today was convened as a result of a discussion at our board meeting in August, wherein we had during the director's report a discussion around the planned release of the RFP for the non-Medicare population for plan year 2022. And as a result, after conferring with President Follansby as chair of this committee, we then convened and had a discussion a bit with Director Yant regarding kind of the broad level, high level outlines of the RFP process. And so the description that is printed as part of the agenda is really the sum and substance of what we'll be covering today. We're going to review a bit of history, market assessment, the purpose, the desired outcomes of the bid process, and then get some discussion by the staff regarding what the rules and regulations are, the requirements, if you will, as well as a high-level outline of key elements of the process and minimum vendor requirements. And hopefully during the course of this, we can respond to some of the broad questions that were raised at the board meeting and provide some further clarification, not only to the board members about this process, but also to the public at large. So this is a discussion item to try to fully understand the how, the what, and the why of the RFP process. And we have been working at this for nearly 2 years as a board. We had a high-level strategy meeting back in June of 2018, where we said we wanted to begin to do this, and then deferred it last year, and now here we are. So with that, I'll call on Director Yant to begin the presentation. Thank you.
And before that, I'd just like to step in and make sure that we all know that the agenda item, speak that out, that it is the item number 3, the medical plan competitive bid for contracts, plan year 2022, non-Medicare population, which, as Commissioner Scott said, is a discussion item. And with that, we can present.
Can you see my screen?
Yes.
Oh, good. I love it when technology works. Good afternoon, everyone. Thank you for this opportunity to really provide a more thorough presentation on the process that's underway for the competitive bid for our medical plans. I just want to start off by acknowledging the work that our staff is putting into this, along with our AON partners. Michael Visconti has been poured his heart and soul into this and collecting all of our good ideas over the last couple of years. And we've consolidated them and are refining the information into acceptable and formatting so that we can produce this document that will be made public, currently scheduled for September 9th. That being said, I'll just jump right into it, and we will do it sort of an overview of how we got here, reminding ourselves of the market assessment that was done, the sort of objectives of the RFP, talk a bit about the vendor procurement policy and rules and regulations, give an overview, a high-level overview of the timelines and the processes, talk a little bit about our panelists and their qualifications in the evaluation process, and really just high-level key elements and minimum vendor requirements. So there's a little mix here of high-level information and some detail, and we are wise to what we are permitted to be able to speak about publicly until the RFP itself is released. So that does, if that comes up, we'll let you know. So just as a big overview, we grapple with this a lot internally as HSS staff, as the demands on our time and the multiple priorities that we have as a team. And I just had our Ryan, our graphics artist, kind of put this together for me a little bit to just so that we can appreciate what's going on sort of all the time. We're in a constant state of preparing for open enrollment, doing open enrollment, wrapping up open enrollment, and doing open and starting all over again. It's the hamster on a wheel, and that's the blue line that goes throughout. We also this year, have introduced the preparation of this RFP. This is the green line on your screen, and the whole process that goes on here for some time, where we bring the results of the RFP to the Health Service Board in February of next year with recommendations on selected plans. During this time, we and as part of the evaluation process, is we do consider disruption and what it means for our staff and our members, and so that disruption analysis is part of the evaluation process. But and so that will inform any kind of disruption mitigation and preparation we have to do for that open enrollment in fall of 2021. So that's what we're looking at, and this RFP process. Therefore, the new plans, the member experience, will begin at OE, the live OE in 21, with the plans being in effect in 22. So it's always kind of a challenge, and I think our board is pretty familiar with the sort of 18-month clock that we have continuously. And so you can see where there's times like right now where we're preparing we're working at multiple levels. So it's kind of like full steam ahead for the entire team at HSS. So I just want to give you that as a context on how we manage the work. So leading up to the RFP, this really began when we did our strategic planning in 2018 and really set the goals, and I'll come back to that in a minute, excuse me. We adopted that plan in October, and then the following July, we did a pretty thorough market assessment. We did realize at that time the market was still somewhat unstable. There were a couple of key things that were going on in the market, some of which are even not yet resolved, i.e. the Sutter lawsuit is scheduled now to be the hearing on that on this Friday, actually, the 4th. So there are some instabilities still in the market that may or may not affect, what kind of proposals we get. But that was and I'm going to come back to the sort of, you guys remember, I'm sure, the different models that we presented on how we were going to go about resolving some of the issues that we have today. So in December, we also presented the member engagement report. I have some highlights of that later in this presentation. And then we talked in June about doing this RFP, and again in August. And so today we have the governance meeting, and what I didn't put on here is obviously is the board meeting next week, where we will continue to discuss this. And when I show you the timeline, I consider it perfunctory that we would be updating the board as appropriate throughout the entire process at each of your regular meetings. So the strategic goals of the strategic plan do tie in very much to what we're trying to accomplish here. So to look at it through the lens of the strategic goals, affordable and sustainable health care plans, where we really do acknowledge member cost, as well as the long-term financial sustainability of the overall program. And from reduce the plan complexity and fragmentation, we are still striving to select vendors who provide comprehensive, and more of these systems are becoming more integrated, and that offers opportunity for our members to have services integrated in more integrated systems. Kaiser is probably the most fully integrated system, but others are well on their way. Engage and support members where individual vendors are really paying attention to health literacy, to how to support the members through care coordination, through advocacy services, and certainly today with a very heightened awareness and focus on race equity and other social determinants of health. We're also very cognizant of the choice, appreciating the various needs of our members and certain special populations that we have, and wanting to be inclusive and attend to those needs, and providing really meaningful opportunity for health plans and design. Whole person and well-being, where we're really seeking partners who support our ongoing health and well-being activities, looking to shift from sick care to health care, and reducing barriers to care, particularly in those areas I mentioned above around the social determinants of health and race equity issues that do produce disparate health outcomes. The market assessment that we did in 2019, as I said before, we did acknowledge that there's vendor and provider consolidation happening at a very rapid pace. National carriers are aligning with pharmacy benefit managers. Consolidation of point solutions from vendors into larger organizations. We had talked, I remember, at our 2018 meeting about all the startups and out in the world, and I think there was some crazy like 200,000 of them. And they've really consolidated and either gone away, or gotten bought up, but there's been a lot of sorting that has occurred over time at those point vendor solutions. Broader market consolidation continues. Today's focus is really on shifting from fee-for-service to value-based care delivery. It's become much more common. It's not a novel concept. We're really looking for ways to pay for quality care. And so there's a variety of tools in the toolkit. We participated in a couple of learning modules with the Catalyst for Payment Reform. Suzanne spoke to the board about that about a year ago. The current landscape is focused on managing cost, improving health, improving member experience, and health equity. Again, there's new vendors in the market every day. I think one of the things that many of us have observed in the recent months is a number of venture capital funded primary care practices. We saw some of we saw that startup One Medical that we had talk to us a while back, but since that time, there's several others. I can't even keep track of the names these days that are popping up in San Francisco as other ways to receive primary care. And how much they're networked, I don't know at this point in time. We also engaged our members directly in a series of focus groups and really to understand their experiences with delivery. And, we really targeted the non-Medicare folks, but many of our Medicare population people did participate in these work groups and were contributed nicely. We had a good participation, and again, the system competition model does seem to resonate well with folks when we talk about that in small groups. So we did summarize how the members see these, how they impact the change on the cost and quality and standards and variation. And so these statements really resonated well with us and do help build, I think, our case for doing the RFP and will inform these selection and evaluation criteria as those are developed. I just wanted to remind the group that this is the current model, that we have 3 health plans, and I think you guys are quite familiar with that, but I want to put it up there so that I can contrast it with where we are headed with a system competition scenario, where again we have carriers, and you see in the center there, carrier 1, 2, 3 is should we find more than one carrier, because that's what we have now. If we should find multiple carriers that can provide different access to different systems of care and different networks with a range of product design, whether whether they're HMO, we have the PPO that we also need to retain for reasons for some of our special populations that are outside our geographic area. So there's a lot to be considered as we work towards having a choice with affordable products that meet the needs of our members. But this is what we're striving for in this process. So, speak of the process, I'm going to talk a little bit about that. It is subject to and abides by many rules. So it's really governed by a lot of authorities that are listed later in the document. There's strict practices in place to ensure confidentiality all along the way, and a level playing field for those that are participating in the process. So that's why there's so much confidentiality, so that there's not an opportunity for someone to kind of get ahead of the game in any way. So we're really careful about releasing information equitable all at the same time, so that there's equitable access to any detailed information that an entity would require to be familiar with in order to submit a bid. And then on the other side of it, when they do submit the information, much of what they submit is highly proprietary and confidential. And so we have processes in place that with the participants or the potential respondents in the process, that we sign mutual confidentiality agreements from the get-go in order to really retain this. And then, so that's a driving value in the whole process. The high-level timeline, as we said, we're getting down to the finish line to actually releasing the RFP. We will have opportunities for respondents to call in and ask questions. Again, there's strict rules about how that's done, when it's done, how it's recorded, and equal access for everyone to do it at the same time. So that, often, one party will ask a question that another party has as well. So it can be efficient to do it that way. October, we have submissions due. There's an evaluation period. Aon does a lot of the financial work. It's a heavy lift, and so they will be working with us to do the receive the financial information and to do the analysis. In December, we will convene a panel that will work in that time zone there between December 1st and December 18th. We all get a holiday break because we want to have the scoring done before the holiday so that we can resume activity in January with oral interviews and in order to be able to present our recommendations to the board in February, which puts us right on target for building those rates and benefits into the process, as I did that overview in the earlier slide. So, like all things HSS, we're a very time-sensitive organization. We really are ruled by the clock, and so this has to fit in that cycle in order to be successful and implemented in and have the plans be live in January 22. I do want to note that there is a fail-safe plan that should we determine that we don't want to make changes, that at some point, for some reason, we would default to the current state. So I just want you to know that we are very aware of that, and we have processes and procedures in place to ensure that we would have a default position. So the objectives of the RFP are to enhance the value-based payment models for sustainable, high-quality, cost-effective health plans and programs and options, to address some of the long-term financial stability for our PPO or non-HMO plans, to enhance the diversity of choices of plans, models, and the integrated delivery system for our members, and balance the enrollment between plans. The partners with plans committed to the strategic goal. We want to partner with plans committed to our strategic goals of ongoing whole person health and well-being. We want to innovate for better management of the drivers of the risk scores. We've spent a lot of times together as a board, as a team, as staff, of really understanding and having a growing concern of the continuing rise of the scores in some of our plans, and so to think about how we can address that. And then really, as I mentioned earlier, when there is a plan change, it is a disruption. So we really want to look at some of the criteria as we move forward to try to minimize that as best we can. One obvious way would be to have a very similar balance of current copays and deductibles, so that that is something that folks can hold on to. Obviously, people are going to want to keep their physician networks and those types of things. So it will require quite a bit, not only analysis on the front end, but the explaining on the member end when we're building our open enrollment education and materials. There's a question about minimum qualifications, and we've got quite a few. As I mentioned, we're pretty highly regulated, and healthcare, as you know, is the most highly regulated industry, I think, in the U.S. And so we have corporate regulations, licensing in California. We have the California Department of Insurance, the California Department of Managed Care. There's business licensing at a state level. There are compliance with state and federal. There's all kinds of security laws, that protect the data, the HIPAA security, privacy breach. This is ever expanding. Excuse me. Back here. Being able to comply, the city has stepped up their requirements for data. that have gotten way more stringent, and which is a good thing. We also look at the financial rating of these organizations. We're not in the business of supporting startups or whatever that haven't quite made the grade yet. We really are looking for well-established organizations that have strong financial footing. So those are certainly the minimum qualifications. Areas that we evaluate in are also, obviously, that first step of the compliance issues, but the other administrative functions in consumer service and claims processing has gotten way more sophisticated today. And even to the degree of, do health plans share their claims information with their physician organization so that they have a total picture of the electronic health record and the claims. Those are sort of modernization of these processes. Provider and pharmacy networks, looking again to minimize disruption and to ensure continuity of care. Reporting the all payers claim database that we have, and are they able to support our work with our partner on the data warehouse. The onshoring of data, this is something that we call out Michael's very good about helping us call out these potential problems very early in the process, because it's gotten common in a lot of industries to offshore data, and San Francisco does not permit it. So we pull that. We noticed folks very early on that, because most organizations are capable of compartmentalizing data and keeping it onshore, but they need to know that they need to do that. Looking for strategic alignment, and then again, some of our special topics that make us I think, valuable to our members and interesting for plans to figure out how to work with us. And that is, we look at the issues around health equity, racial disparities, special populations, ability to innovate, understanding the complexities of care coordination, and supporting the social determinants of health, and the integration of behavioral health. We're still on a path, I think, industry-wide in healthcare to more fully integrate behavioral health, and that is important for us, especially during these times. And then the financials of looking at the discounts, fees, premiums, the pay for performance, provider contracts, and performance guarantees. So those are the types of things that are key areas of evaluation. In the process, we have a panelist that really help us, and other advisors that we've spoken to certainly aren't experts at PDGH and CPR. We've worked with over the years. They have a lot of standard tools for doing RFP that have been very helpful. There's certainly a lot of expertise out there on how we measure quality. There seems to be a growing body of consensus around what we can hold plans accountable for, because there's more consensus and understanding of that. So that's all working in our favor. Our actuary, of course, has tons of experience with these types of RFPs, and so do our city attorneys. So we've really got a pretty robust team of advisors helping us. And then we go through and have begun a selection process of our panelists, where we, again, will formally engage them in December. But we took an approach that I think most of you are somewhat familiar with when you're trying to put together a governance board or something like that, where we really sat down, first of all, and identified the expertise that we needed in the room as for the panelists as a whole. And then we started identifying people that had that expertise. And so that's the way that we've gone about looking for and engaging folks that are potentially panelists, or some have already agreed. We've talked to, and this was very informative, and one of the things that we've been wanting to do on a number of levels is really engage with other county, Alameda, Contra Costa, San Mateo, other county agencies that are doing similar work. And because we're having similar issues. So it's been a good, healthy exchange of understanding what folks have gone through that have done RFPs and some that are considering it. So there's been a very good collegial professional development where we have on occasion had staff sit on their panels and they're happy to contribute to ours. So that's been good. And then there's folks throughout the city that have particular expertise that are helping us as well. We're aiming for a panel of about 7 to 9 people. We will have alternates just like a jury so that if life gets in the way for individuals, that we have a backup so that we have maintain a strong presence of folks that can help us. And then the last is I mentioned early on some of the governance surrounding our process, and our board has thought about this in advance. There's policy language here that I'm sure you're all familiar with that talk about the role of the board and then vendor selection. And so that's the wording there from our policy to help us understand those roles. And then this is just a summary of all of the authorities. I just mentioned the governance policy, but there's charter language, there's administrative code language, around a ton of language around how we go about getting contracts and what all the rules are to ensure that there's a fair and level playing field and things are done ethically, morally, and legally correct. So we have a lot of rules that help us do that. So that's a lot of information. I have my team here with me today to have a conversation. I'm happy to go back to any slide that you had. Claire, you mentioned you had some questions. So Commissioner Scott, I the mic to you at this point.
Abby, I want to thank you for that very well-crafted presentation in terms of this process. And I would like to also thank those on the HHS staff who've worked so diligently to bring us to this point. I know it's been a ton of work beyond your daily schedule of activities, even preparing for this current open enrollment season and what have you. So I do thank you for that. I'd like to ask the commissioners if they have specific questions, and then we can go from there. Commissioner Follansbee, Commissioner Savansky. All right, Commissioner.
I'll yield to
Savansky.
Dr. Follansbee. Dr. Follansbee, do you have questions first?
You need to come off of mute. There you are.
Okay, thanks. So again, I also want to reiterate your compliments, Commissioner Scott, because this is really quite a presentation. And I think the implications of many of the points that are being made in this presentation are very complicated and hard to summarize, and including issues around, where the vendor community is going, et cetera, et cetera. We've started to deal with this as a board. I have just a couple of housekeeping points. One is the slide that looks at slides, and I had a hard time with the numbering system, but I think they're slides 11 and 12, which listed who coordinates care. And I just want to point out there's a discrepancy in the last category in terms of who's coordinating care. And it looks like under the HMO Kaiser that the health plan coordinates care for members, where in all the other HMO, another the competitive scenario or the as it is now, it's all listed as healthcare providers who are actually licensed to coordinate care. And so I think that the slide's a little misleading, that the health plan doesn't really coordinate care, I suspect, at Kaiser, since the health plan is not licensed to provide care. And so it really should be the provider and TPMG, or the Permanente Medical Group, which is made up of a whole host of providers and coordinators and et cetera. So I think that's a small detail that I just don't want people to be confused that some plans have the health plan is self-coordinating the care, which would be a conflict of interest, quite frankly. So,
Thank you for that clarification.
and then the other,
Anything else, Stephen?
yeah,
Yes,
the line, I think it was slide 13 or 14. It was just again an editing thing. Is that I appreciate the fallback plan, and if you just have this, make sure that the slide has the asterisks. The data set the slides that we were provided had the asterisks only at the bottom of the slide, but not under the timeline February 2021. And then the slide that we saw online had the asterisks under presentation results, but then no asterisks. It defaults to BSC. So you have an asterisk in both places just to make sure it's clear. But again, I think the presentation is quite clear. Thank you.
okay. Thank you. Commissioner Savansky?
Thank you very much. And I made note of Dr. Follansby's comments too. I appreciate that. And a super thank you to all the staff who participated in this. It's an overwhelming process. And I found a couple of boxes that I've used almost like tables that still have those old binders from many years ago when all the board members would get the submissions. They'd submit, I don't know, 20 binders full of their proposals, and we'd all review them. And the board, the rates and benefits, and the board sat as a review panel. So a little bit of my comments and my questions come from that experience. I'm wondering if Aon is going to present us with some of the history of the vendors, and if we're going to get, as board members, if we're going to get a list of who all the vendors were that submitted proposals. That's number one. And of those that are presenting, can we know how many have had experienced mergers or buyouts in the last 5 to 10 years? Because what we see, as Abby pointed out, and that may be too much to expect, as Abby pointed out, there's been a lot of consolidation, there's been a lot of movement in that industry. So I thought it was narrowing down to 4 or 5 major national healthcare delivery systems, but it sounds like we have many more options. And we're looking for vendors who can provide care on a national basis, because we have retirees, both retirees in almost all states, or in many other states of the United States. So I would be curious as to the vendor history and how far they cover. I'm going through, because by the way, when we look at the expectations for service standards and accountability.
Just a moment, Commissioner Savansky.
Yeah.
I think it might be helpful. I recognize what you have is a series of questions.
I do.
And so why don't we raise the questions individually, and then allow either Abby or their staff member to respond to that question, and then come back to the next one, and so on. I think
okay.
rather than trying to kind of remember all of this and then respond to it all. So if you could kind of segregate your questions, and then we'll get a response from Abby or a staff member. All right?
That sounds
Excuse
good.
me,
And
I was on mute, and I thought you heard me. Before that, I didn't punch the red button. No problem.
And I wasn't
so if you start.
Yeah, I just wasn't looking at the screen to see who was muted, so I apologize.
No problem.
Commissioner Scott.
So let's start with question 1. You said something about will we know the vendors, and something after that, please.
And about their history and what the mergers or buyouts have been within the last 5 to 10 years. Would we get that information?
All right, let's start with that. And so Abby, or whoever is Michael, or whomever is managing, and I presume that you're talking about post the evaluation process.
Yes. No, excuse me. Oh, well, yeah. Or pre the evaluation process. I guess what I'm looking for is to know, because post-evaluation, we will know how many vendors remain in the running. And I'm just wondering if we're going to get any kind of notification as to who the ones were that submitted proposals and
All
why
right.
they were not chosen. Yeah.
Okay.
Yes. Let me just answer the questions. Yes, all of the respondents will be disclosed, and yes, there are questions in the proposal already about mergers and buyouts and legal proceedings, et cetera. And
Okay.
Claire, your voice is still a little muffled. Is there anything that you can do to?
Oh God.
Don't mess with it if it's not.
I've been having microphone problems with Zoom, and it may be that I'm going to have to get an external system because it might be a problem with my laptop.
It's a little positional because at some points I can hear you fine I think it's a little bit positional.
Is it better when I face the
Yes.
computer?
Yes.
Yes.
Ah, thank you. Because I don't know where the microphone is. I've searched. I can't find it. Okay.
Thank you.
All right.
Thank you.
Well,
Okay.
right there is kind of where it is. So thank you, Claire. Next,
Got
what's the next question?
When we look at accountability, what is being contracted out? It was on one of the presentations, the RFP aims in relation to member asks of HSS. And I noticed that there were comments about third-party partner support. And my concern is, in terms of what we're requesting and what the vendors may submit, do we have any consideration for how much of the services or what services are reasonable to be contracted out? And then what is the accountability of those third-party contractors? And that's my concern, is the third-party contractors.
All right.
Yeah. Are we talking about the contract itself, not the panel, right?
Oh, right, not the panel, no.
Okay. But yes, virtually all of our vendors today, and I imagine in the foreseeable future, do have partners that do sort of particular services or programs. All subcontracts are subject to an approval process that they have with us, and those are all disclosed. In this process, they would all be disclosed. And their accountabilities would be described in the contract. We have many pages of required reports based on either regulation, best practice, and other program planning that we do.
Okay, that sounds good. We've covered that. One of the things that occurred to me in this process, we're sending out an RFP, and I guess there's an assumption that only one plan is going to be accepted in the long run. And this was an issue that some of us, I know Commissioner Breslin has commented in the past, she and I both have commented that we recall that there were times when we had more than just three primary carriers, because these days it's Kaiser, it's Blue Shield, and it's UHC. But in the past, we've had 4 or 5. And
I think if you go to this competition scenario model, it doesn't say that, Claire. It says that we are looking for more than one model.
Okay, so we might.
Yeah, the screen that's up, the shared screen that Abby has here says carrier 1, 2, and 3. So I don't presume that means that we're going to get down to 1 in that bucket.
No, that's what we have now. We have 1 now, and that our desire would be to have more than 1.
More than 1.
Should we have multiples that are suitable and we can get the right kind of spread and mix to make it affordable?
Great. Okay, I just wanted to confirm that was a consideration because it has
So just to be clear, when we kind of talked this through as a board, and came up with the fact that we needed to have more. What I had found when I was with another large educational institution here in the state of California, and we went out for bid, that the field got narrowed because we couldn't guarantee them the number of people for a threshold enrollment in their plan. And some of those that we thought we might want to have pulled back. Now, and we may find the same thing here. It's our desire, but if it's not ample enrollment, that plan may come back and say, we can't play in this field. So that's what this process is trying to test out. And my hope is, however it happens, and I'll let Abby and the rest of the staff talk about this, that whatever happens here, that they can, the finalists will know that we will be constantly pushing at them around quality and price and outcomes. That's part of the deal. So it's not just like a one and done. You got through the RFP process and it gave us wider choice. And then in the second year, you're off someplace else because you've got another set of fish to fry. So that's going to be kind of the trick in here, I believe.
I understand that, and Tuolumne has, our Hetch Hetchy people have hit that wall constantly, and so I'm very aware that there's a minimum, especially in HMOs, there's a minimum requirement to have so many who are available in a specific area, right, covered lives. And I guess what I want to know too is, and this is a naive question, I apologize, is it possible that an HMO would have a system where someone wouldn't need a referral to get additional or other care, that they could go to anyone else, say in a network, and wouldn't need that referral from a primary care physician? Or is that kind of an essential element of the HMO and one of the rules?
Yeah, I think those are guided by the Department of Managed Care rules. So to the degree that there is wiggle room afforded by the regulatory agency, we would consider that, but that's sort of the rule.
No, I thought that might be it, but I just wanted to confirm. Okay, I still have a couple more questions, and I appreciate the fact that
I'm sorry, Clara, you're going out again.
Okay, I have a few more questions.
Okay.
Thank you for tolerating me. And I guess I understood that we have health service staff is going to be involved in, senior staff is going to be involved in the evaluation process as well. Is that correct?
Yes.
Okay. And one of my biggest concerns is continuity of care, which Abby, you mentioned a couple of times in your presentation, but my concern for continuity of care is a little different. What I found in my own personal experience and in talking to other members of our system, when they hit age 65 and have to go into Medicare, and I realize we're looking at non-Medicare, I get that. But when they hit that wall and they have to go into Medicare, the worst message you get is, hi, remember me? I used to be your doctor and we don't take Medicare. And so now you have to find a new physician, new primary care, new allergist, new internist, new everybody. And for some of us, it took a couple of years before we could even begin to search again, because it's devastating to have to start over at age 65. And I'm wondering if any consideration is going to be given in this evaluation process to vendors that we know or will let us know that they also have Medicare or Medicare Advantage programs available, so that when that time comes, we could look at those same vendors and have a continuity of care, and again, less disruption. So that's my biggest concern here. And that's why I'm looking at, do we have more than just, 3 or 4 vendors, 4 saying city plan is included? And what is that consideration that will be given so that there will be a continuity of care when people age into Medicare? Last question, that's it.
Okay. Abby, do you have a response to that, or any of your team members to that question?
Yeah, I think we're getting a little close to what we cannot talk about in this public disclosure.
All right.
What?
So, but I guess I would then go to this point, that as you are active in your consideration, you've heard an expressed concern about transition from active to retiree and the continuity of healthcare delivery around that. So that would be an issue or a concern.
That is an issue. That is an issue. It is on our strategic plan. It was emphasized in the focus groups.
Okay.
That transition to retirement, whether it's an early retiree or an age 65 person becoming eligible for Medicare, there's a lot of confusion and assistance that we are considering how best to provide, whether we provide Medicare advice or whether we partner with community-based organizations or whomever, Medicare itself. That probably isn't likely. Yeah, I think that it's a very important issue. But delving into the whole Medicare question is sort of outside the boundaries of this conversation, and we'll be doing a board education on what that market looks like in November.
Okay, very good. Thank you.
Mm-hmm.
Are there any other comments from you, Steve, at this point?
Am I muted?
No, you're not. Now you are. You weren't a moment ago.
So, I'm sorry.
There you are. No, you're not.
Now I'm unmuted. Okay, yeah,
Yes.
No additional comments. I'm not going to comment on the continuity of care because I think we all value this. But at least I will say in principle that we need to make decisions that are best for all of our members and for the health plan and our fund as well. So we'll just have to leave it at that.
Is there, I guess, if there are no more questions from the commissioners who are committee members, we would open it up for public comment at this time. So,
and Commissioner Scott, I also wanted to welcome and acknowledge Commissioner Breslin. She's been on the call line, and I'm just going to unmute her for a second, make sure that she's been able to hear, but I want to make sure any comment comes through.
So we're now in public comment or other board members' comment. Commissioner Breslin, do you have any questions?
Can you hear me?
Yes, we can. It looks like you're muted on the
icon.
On
the phone? Are you hearing me on the phone?
Yes.
Yes, we are.
I want you to know the first number I called, I went on a little bit, boom, they cut me off. Second time I went on again, they cut me off. Then Brian gave me another number, which worked okay. And I have to say this new system is just not very desirable. I mean, if people are having this much problem calling in, then I'm wondering if the public are able to comment at all. I mean, I'm really serious about this. I mean, we have to have a better method than that. But anyway, I'm hoping that there will be some way you can get this, all these documents on our email or something, because I couldn't see any of them in the beginning. I missed part of that, and I missed all the conversation, almost all the conversation in the beginning. So that's my problem. Anyway, it
All
looked
right.
like a good presentation, but I missed most of it, unfortunately.
All right. Well, I would ask this, do you have any particular questions about what the portion that you did see, or questions about the process at this point?
No, my original question was that, our rules and the service provider and vendor selection policy, that, the board is supposed to be very involved in this. It's clear that it says that in it, which I don't think that we were. It's too late to be doing that now, but in the future, I think we need to look more closely at this because, it was just put out that we have an RFP, but I don't remember us really doing a lot of input of what is it we want, because it's pretty detailed on our rules that we should establish appropriate policies to help ensure prudent and sound election decisions are made, including, but not limited to, providing input to management about broad policy directions of specific goals and guidelines. So I don't know that we've been doing this the last few years, although we haven't done an RFP for a while. But that's my concern, that we are not really doing our full duty here on these RFPs in the last few years, although we haven't had that many, actually.
I understand, but I think at least as we look at this competition model and the market assessment and our hearing of the report from our staff members and former staff members, the forums and so forth, I think we have, as a board, been engaged at various steps along the way to get to this point. And I can't say that every one of those meetings said above it, this is going to go to the RFP, but to get down to this competition model and the objectives and the strategy that we've talked about, I was a part of that, and I believe you were as well, in those various meetings over these last 2 years. So this slide that's here, the strategic planning, the adoption of the strategy, the market assessment, member engagement, those steps are at the level that are consistent with the terms of governance. And so, and they've led to a more detailed description of requirements that fall under the RFP codes and the other strictures of this process.
Yeah, well, I do think that we should be able to see the RFP, not this time around, of course, because it's too late for that, but I do think that should be part of it.
Well, as I said, I think given the terms of governance that we have had and the current rules, in one way, it might be that if we are that deeply involved, and it's a question, then how can you then take a more fiduciary role in a later step and make the decision? So, it's almost that you're
well, no, you're just saying what you want to see. Which is a lot of the presentation presented that. But to say that we shouldn't be involved, anybody that's involved in the process could do something irregular. Anybody, the staff or whoever, that's a possibility. Not only the board members, but the staff. So.
I understand. Well, if you're talking about the ethics.
If we're blankly approving something that we really haven't even seen, that always seems strange to me at this point. Well,
I think we're allowed to see if after the fact, but I'm just saying that we've heard that we're going to find out who indeed bid. We now know what a little more of the detail of the process, and that we'll be getting updates from the staff through Abby and her reporting on how this is going over the next term. I don't think that I'm going to be uninformed, if you will, when it comes to a decision of this magnitude, and none of us should. And if we do have questions, we should be raising them at the points during the course of our meeting. And we'll be told either we're at a point in the process that can't be publicly disclosed, or it will.
Well, we don't sit in on negotiations, so we don't see any of that. We don't know what's going on until they decide who's choosing, as far as I know. And that's the way it is right now. But I'm just saying, I don't know if that's really the way it should be in the future. So Anyway, but I do think this was a good presentation. Unfortunately, like I said, I missed it, a lot of it. So I hope that it can be sent out to me in an email or something, perhaps.
Yeah, and Karen, I'm happy to spend time with you and to go through it if you'd like.
Yeah, it's all right. I just couldn't, like I said, I just missed it. So,
Yeah.
Okay. All right. Well,
but I
that'll
do
be a
hope that in
follow-up
our
step.
future meeting, like next week, I wonder if this system really is. Seemed like the system we used before this worked a little better, at least for public comment.
Yeah.
I will refer that back to the board secretary and to Abby.
Yeah.
To see if we can indeed get a little bit of comparison. It may be the technology that's involved as well.
Because I don't know if anybody tried to call in today or not, but I know what happened to me when I did this calling.
Yeah.
So we're gonna find that out right now because we have opened it up for public comment if there is any public comment.
Right.
So
Right.
Holly,
Okay.
would you at this point go through that process of how people can call in if they are members of the public and so forth?
And by the way, I want to thank the staff for the work in this too. I know because it's not a good time for anybody to have to do all this extra stuff. So thank you.
Okay, thank you, Karen.
Thank you.
Claire?
Yeah, thank you, Commissioner Scott. I just want to say that I agree with Commissioner Breslin because we as a board are ultimately responsible for the final decision. And that's why I think we're asking for more information because we have an obligation for due diligence and we've just given it away to somebody else to make all those decisions and then submit a final recommendation to us. And we hold the responsibility ultimately for that decision. And that's my biggest concern. If we don't have much more information, it's very difficult to say, okay, I'm just going to go with what you said and trust that everything has been done right and that I won't be held accountable in the long run for a decision in which I was only allowed a final vote. So I think that's part of what I heard Commissioner Breslin saying, and I know that's been my concern all along as well. Thank you.
Thank you. All right. Going back to the board secretary, if you'd go through the steps for other public comment.
Yes, thank you, Commissioner Scott. I am going to ask Director Yunt to pull down her slides, and I'm going to post up a slide to help any public comment procedures.
Okay. Oh, stop sharing. I found the button.
Okay.
Oh.
I'll be sharing the screen that shows a little bit more. And as of now, I can see there are active callers on the line. We'll wait and go through the process to see if anyone wants to participate in the public comment.
Is it posted up there how to call in?
Yes, that's what she's getting that content up there now.
Oh, okay.
Okay, I'll go through. I'll just read out a few.
Thank you.
A bit of the information. So as we know, public comment is made available on this agenda item. Each speaker will be allowed 3 minutes to comment. The phone number listed here, 408-418-9388, is our entry call with the access code 146-188-9382. To participate in the public comment, you'll be pressing pound and then pound again, and you'll be entering as an attendee. And we will want to wait just a few moments to make sure that callers can enter into the line. And our moderator will be helping for those callers. If you dialed in and you do want to speak, you'll need to press *3 now, and you'll be added to the public comment queue. And then when speaking, you'll hear a message that says your line has been unmuted. When the moderator has unmuted your line, and that's your time to speak. And when we've heard from the moderator, we'll welcome our first caller. So moderator is on the line. Please let us know if there are any callers who wish to comment on the agenda item.
Good afternoon, Board Secretary. There are 11 callers on the phone line. One has specifically entered the public comment queue at this time. A reminder to all callers on the line, you must dial *3 now if you want to join public comment item for this specific agenda. We will wait a few more seconds. Commission Secretary, there will be a moment of silence as callers are elevated. Board Secretary, if you could also allow me the privileges, I will unmute the caller.
Gladly.
Board Secretary, I've been granted presenter privileges. If you could adjust my privileges so that I could unmute the caller in the line.
Thank you, moderator. One moment. Moderator, you now have access.
Thank you, Board Secretary. I have been granted host privileges, and I am unmuting the first caller.
Welcome, caller.
Can you hear me? This is Fred Sanchez from Protect Our Benefits.
Yes, we can hear you.
Okay. Yes, it is a complex system. I mean, Holly and Abby Yant have been very helpful. We've been working together to try to simplify the system. It's worked well this time. The only thing that was rather, I don't know if it was Abby's choice, but I could never see her on screen. Maybe she chose to do that. It was a fine presentation, but I couldn't see Abby's face. I mean, it was a great presentation, but I don't know if that was part of the process where she intentionally didn't want to be seen.
It wasn't that I didn't want to be seen. It's just that when you're doing a presentation, I need a different screen setup that doesn't have a webcam.
That's fine. Then that's really explainable.
I was just talking to our tech team about getting a webcam because it's set up so that I can do just what you're suggesting.
Yeah, the only other concern I would kind of share what Karen Breslin and Claire Zavansky saying, like, ultimately the trustees are the fiduciaries. They are the ones who have to give the final decision on whether to accept the providers that will be accepted. And without having some kind of ability to see it, I don't know how much time they need to see it. It's like Dr. Hornsby today looking at your presentation and wanting to put a few asterisks certain places. It just seems that without having the ability to even see it 30 minutes prior, so that, hey, I need a little clarification on this. It's really hard, and they're all extremely bright trustees, but to go totally cold, kind of after the fact, hey, this is it, it just seems like there should at least have some ability to see it prior to the actual decision-making process. I don't know if that's a legal issue, but that's my feelings.
All right, caller, you have 30 seconds left. Anything else?
No, nothing further, but no, I thank everybody for this effort. I know it's a tremendous effort, and we appreciate your time. Thank you.
Thank you for your comment. Next.
Thank you, caller.
Board Secretary, we have 11 callers on the phone line. No other callers have specifically entered the public comment. A reminder to callers at this time, if you select dial *3, you will join public comment for this agenda item. We will wait 5 more seconds and then close public comment for this item. Board Secretary, there are still no callers in the public queue at this time.
Thank you, moderator. Thank you, Commissioner Scott. Hearing no more callers, public comment is now closed.
Thank you very much for that. And my hope is that as we go forward through the balance of the board meetings on this topic, that there will be generating more comment as the process goes forward. And we thank that those parties who are listening in, as well as for the person who did make public comment. So with that, we will move to item number 4 on the agenda.
Excuse me,
Yes.
Chair, can I make a couple comments? One is that, as commissioners, we did have access to the slide set. It was posted on our Dropbox, I think yesterday or the day before, and we got an email with that. So we did have access to look at this ahead of time, and I appreciate that. And I guess that Commissioner Breslin, you may have access to the slide set as well through Dropbox. I'm not sure if it's available publicly, but it certainly is available to us as commissioners. And then the other comment that I wanted to make is, when it was a question, actually, a comment and a question, is that, going through this presentation, I found no surprises in terms of what we as a board have been apprised of, have been talking about in terms of the issues around health plans, health plan selection, and what we're looking for. And so I, again, appreciate all the hard work of the staff to put this together. I am concerned about the implication that maybe the RFP is going to have things in it that aren't here, elements of that. I'm not quite sure what, the suspicion is. I do note that there are interviews in January. And I guess the question I have is, how are those interviews held? And is this a place where commissioners could sit in and listen again to the kind of questions, rather than I guess the concern is that that we as commissioners will be waiting until February for a final presentation. But there is another step. I certainly don't want to be reviewing RFPs and trying to, unravel all the details. They're often, volumes. So the question is about the interview process in January.
Trying to find my microphone.
Yes.
Interview.
Abby, if you could comment on that particular item.
Yeah. And I might have Michael chime in here. He's still listening. The oral interview is a next step in the interview process. As I mentioned, the panelists convene in December and do a written analysis as a team. And interviews are a next step where you have the opportunity the respondents will have an opportunity to present to the panelists, and question answer period between the panelists and the respondents will occur. They're very tightly orchestrated. It's not a casual conversation by any means. There are criteria under which the respondents are required to guide their presentation. There are criteria under which that presentation will be judged. And there's exchange amongst the panelists at that time that really helps narrow the selection.
I appreciate that. I guess the question is there a reason why commissioners are excluded from
Right.
that step?
I wouldn't say they're excluded, they're not included. I know it's the same thing, but it is my understanding from the governance policy, the board's governance policy, that the board is not directly involved in the RFP process. So that's the way we have constructed the process today.
So just to follow up, so given that we are not panelists, and I appreciate that, because there's a lot of time actually involved in reviewing all the RFPs and going through each one. And I've been involved with that in the past. And I understand that, not for the health service system. But I guess the question is that can commissioners be observers to the interviews if we so desired to hear the kinds of questions that are asked and the issues that are discussed within the constraints of that process?
We would, it's not outside the realm of possibility. We would have to have a process for how we make the decision to do that and define the role of the observer, in that they would have many of the same constraints that other patients have as far as their and their role would have to be carefully defined, and so it doesn't disrupt the process in any way, and that the confidentialities are all retained. So we have not yet entertained such a recommendation.
Well, this is Randy Scott. I think that given the level of this discussion today, and I would completely align myself with Commissioner Follansby's comment that we as a board have had opportunities to contribute to the process and have marked our way along the way to get here. So the question that might be before us is whether we want to review whether indeed at a later step, i.e. the time of these interviews, it would be appropriate for commissioners to be observers in the process. That's the question. And I guess the question is, how do we resolve that? Is that a legal issue? Is it an issue that goes before the contractor administrative code that we're operating this under, or how will we possibly resolve this? Or what's the next step?
Okay. Do you mind if I speak? This is Eric Rappaport.
Yeah.
So I've looked at this issue. I think if this is something the board wants to do, I should talk about it with Abby over the next few days. I think, at the outset, any observer would be required to sign the confidentiality agreement. And I'd just like to make sure that I talk with Abby and the management team about what that role, what the observer role would look like. And then if the board wants to do this, then they could vote as a board to have an observer, we can come back and we can try and come up with an option, and then the board could vote to
Are you there, Eric?
sorry, the board could concede, so theoretically, yes, the board could vote to assign an observer. I would caution you that what we need to think about is if you have to, I'm not too sure what the observer would be able to report back, because as I understand that the ultimate decision to approve the final vendor selection happens in open session. So, you need to think about, okay, so I'm not too, outside of some general assurances, we're going to have to abide by that confidentiality agreement. And so I'm just flagging that as an issue.
All right.
But if the
thank you.
board wants to send an observer, which I get that there's some interest in doing, I'll talk to Abby about, how that would be done consistent with the legal constraints that are out there. But at the very least, I think you'd want to have a board vote in an open session to authorize that observer. So it's clear that this observer is being designated by the board for the purposes of assuring the board that the RFP is, that there's a level playing field and the RFP is being conducted in a fair and equitable manner.
Claire, do you have a question about this?
Yeah, I have a comment and a couple questions. One is that some time ago, Rates and Benefits held hearings, and all of the those that submitted to the RFP, or at least the finalists, were then interviewed in a Rates and Benefits meeting, and so it was open session. And I see that that process changed over the years so that this is all done behind the scenes. But I think our question was not about sending an observer, but allowing as many of us on the board to monitor or to listen in on the question and answers. And I guess that brings up, because I was going to ask for Eric, the real issue of if we reach a quorum number, then we can't have, we're limited to no more than 3 individuals participating because 4 presents a quorum. And I think, is that one of the concerns, Eric? Because if we're not in session and we're not participating and speaking and allowed to ask questions, and we're just being allowed to listen, does that still end up constituting a quorum, and is that where part of the problem lies? Because I think we're sworn to the confidentiality regardless of whether or not we sign a paper. That's just part of our process and what's expected.
No, I disagree with that. It's not just what's expected, it's what's required. And these companies at this point, as well as ourselves, are not just going to assume that we're there if we haven't actually executed a written document, because that's part of the contractual engagement in this process. So what our duties might and our ethics are, and we hold ourselves very highly and bound by those, would certainly be governing. But I don't think that we could in any way undertake this without signing those same documents that has constrained every other participant in the process. But Eric, please.
Yeah, I agree. You're going to actually, I mean, this is a fairly formal RFP. You're going to have to sign whatever the confidentiality agreements that they have negotiated that I expect the panelists will have to sign. Again, you're the board. I understood it was going to be 1 observer, but now it sounds like you might have more than 1 commissioner. Again, I can talk to Abby about it. Claire, do you have a sense? I assume not the entire board does not want to do this. Do we have a sense of how many board members are actually going to want to, assuming we...
Well, I think she said we don't want to constitute a quorum. And so
I understand that's a separate issue. I mean, I will look at the Brown Act issue. I don't know, if you're just an observer and there's no exchange of ideas, information among members, I mean, I'll take a look at it. There may or may not be a Brown Act issue, but so it sounds like the board would like to possibly have more than 1 commissioner observe if this is an option that's available to the board.
Yeah, that's the basis of my question, because I believe there's at least two of us and maybe more who might want to. I can't speak for the others.
Right. Okay, so thank you, Claire.
I'm sorry, Eric, if I could just chime in here. I do think that it very possibly should be more than 1. I think each of us brings to the board slightly different perspectives. I think that we should discuss, though, how we might encourage perspectives and not necessarily have all the people listening in representing, sort of 1 perspective or 1 concern. I, for example, as the physician, would want to hear the discussion about how the medical plans are really operating and a lot of the medical side of it, which I take very seriously. But I certainly don't pretend to represent the active or former employees of the city and county of San Francisco and our other constituencies. I can understand that we would probably want one person representing at least that segment as well. And I think along with a confidentiality agreement, as the chair discussed and reaffirmed, also clear guidelines. I think you made a very important point about what we could or could not disclose. And it would be, I think, in the sense that this is being generated by the need for some reassurance in the whole process. And so some guidelines to any of us who might participate as observers only.
Well, you're not going to be able to disclose anything.
Right.
I mean, realistically, you're going to be able to disclose about zero. And I get it. I hear you. Let me discuss this with the, I think there's a host of issues, not the least of which is the panelists are there for a reason. And if each, let me just take a look at, realistically, what the parameters of this would look like, given that you have an RFP process with panelists that will be rating the vendors. And it's important that there be a level playing field ultimately at the final approval stage and all throughout the process.
And I just point out that, again, we don't know the composition of the panelists. So we don't know that it is how it is balanced among the clinical issues, all the rest of it as well. So I just point that out that, again, I think that the board has a responsibility to understand, how all of these goals for the RFP and objectives, et cetera, qualifications are in fact implemented in a balanced way.
Okay, well, I have divined what the board wants from this governance meeting, and I will work with Abby to both review it internally with the HSS management team and run it through our RFP legal team and try and come up with a solution that meets everybody's needs.
All right.
I would just like to interject, if I may, that I know there's a level of discomfort and distrust in this conversation that needs to be named, number one. And number two is that when the RFP is released, many of your concerns and questions are going to be better understood. We simply cannot talk about it at this point in time. And so I just want to kind of set an expectation that you will know a lot more when this is released.
And I would, sorry.
And the other comment that I want you to appreciate is the impact on the process when multiple commissioners are in the room with panelists who are not paid, who are volunteering their time to be participating in this process, and the dynamic may be different. So I just want to, kind of let you kind of think about what it is that we're aiming for here, because I believe that if it's an understanding and a trusting in the process, once the RFP is revealed, that will be understood. And then should we go down the path of having an observer, the observer is to observe the process. And, because as you will see, we've chosen panelists for their expertise to address these very concerns that you're expressing.
All right. So you've heard from the members of the committee, and I think they're reflective of some of the broader board member concerns that generated this meeting. And so we now have this issue on the table. I would say in terms of timing, in terms of getting a response around this question, we shouldn't be looking at that for this coming board meeting, but sometime later. The RFP is going to be released next week. We know that. And these interviews and that selection, the interview process, if you will, is a later step. So that's post-October. Now, we can certainly get an answer before then, but it shouldn't be one that would be a centerpiece of the board's discussion of this report next week, I hope. But Eric and Abby, I would expect that you would begin conferring on this and then come back to us or to the board president with the response.
So just,
Yeah, I think that makes sense. And I would also add that once the RFP comes out, if any individual commissioner has a specific question about it, they should feel free to call Abby a one-on-one. That won't violate the Brown Act. If they have any questions about, what some aspects of the RFP mean or concerns that they want to raise with Abby at that time, obviously confidentially.
so we will be able to see the RFP when it's released.
Yeah, I think everybody does. It's a public
Okay.
document.
Perfect.
Public
Okay.
document.
I think that needs to be really stated clearly.
Yeah.
There's some
State
confusion.
also, Michael has taught me that the even the name of the panelist is kept confidential so that they are not subject to undue influence. So just so you know that, I won't be able to tell you who the panelists are until we've concluded. But we do have the matrix that shows their qualifications as far as what we were seeking and whether or not, and so that we have that balance on the panel.
Well, as I said, I think that this is a follow-up issue for discussion and to be brought back through the president's report and the director's report at a board meeting regarding how, given the legal advice that we're seeking. The object today was to raise the issues, to explore and explain the process. I think we've done that. And so now the next step would then go back to the board with this report that, yes, we've seen all of this, the RFP is out, and now we're ready to talk about our further engagement in this process as we go along. And this would be a part of that. So are there any other questions or issues or concerns? I'd ask that of the members of the committee at this point.
None for me.
All right, Claire?
None from me at this time either. Thank you very much.
Oh, okay, thank you. And Abby and Eric, you will do your conferring, and then we'll get back to the full board at a later date on this topic. Item number 5.
Thank you, Commissioner Scott.
I'm sorry. No, it is item number 5. We had an opportunity for the public to comment on matters within the board's jurisdiction. That was previously called for. It is item number 5 at this point.
Okay, I'm going to pull up our screen. Is everyone seeing the large screen?
Yes, please.
Okay, I'm going to get us to our next.
And excuse me, isn't this more a comment within the committee's jurisdiction? Because we're not the full board. And so that's why my response was, if I have board issues, I'd take it somewhere else. But if it's with regard to this committee's jurisdiction, right? Just trying to split hairs here, sorry.
Yeah, you are.
I'll leave that to the legal counsel at this point.
Withdrawn.
I agree that Claire is splitting hairs.
All right, thank you very much. So, Secretary, would you please proceed?
Okay, thank you. Agenda item number 4 is the opportunity for the public to comment on matters within the board's jurisdiction. This is a discussion item. So I will, with that, give privileges to open up our public comment. We'll take a few moments. Thanks for your patience.
hand is just still raised. I'm going to elevate the same caller at this time to see if he has anything else he would like to add to this agenda item's comment.
Welcome, caller.
Hello, are you there?
Welcome, caller. Are you on the line?
Commission Secretary and board members, the same caller has been unmuted. There is a possibility that he has nothing else to add to this conversation and that his hand is still elevated by accident. There are no other callers in the public queue at this time.
Thank you. We will now close this item and go to agenda item number 5.
Thank you, moderator. Thank you, Commissioner Scott. Agenda item number 5 is the opportunity to place items within the board's jurisdiction on future agenda. This is the discussion item.
Is there any public comment?
As we wait a few moments, our moderator can update us.
Board Secretary and Commissioners, there are 7 callers on the line, 0 of which have wanted to elevate public comment.
All right, thank you.
Seeing no other callers, public comment is closed.
Thank you very much. And we do know that we have a pending item coming out of our discussion for future board agenda. And with that, having covered all of the items for this announced agenda, again, I want to thank the executive director and her staff for the work that they put into helping to support this meeting today, and that will report out on Thursday through the president or a member of this committee, in that I may not be available for that board meeting on the 10th. So with that, this meeting stands adjourned.
Thank you, Commissioner Scott. Meeting
Thank
is adjourned.
Thank you.
Thank you. Good meeting.
Thank you, Holly.
Thank you.
And thank you, Holly. Great job.
Thank you.